Hey, it's Dr. Pierce from Michigan Sports and Spine. We're on our 19th show, so we're going to be breaking into 20 next week. And again, we're looking for you guys to make some suggestions. We got some funny suggestions already, so we appreciate that. But I think we're going to pass on that for right now. We got to keep it clean here. Anyhow, big shout out to my daughter and Madison. They're out in Colorado, so we're throughout the whole country now watching. So we have some friends in California, Colorado, and some people on the East Coast. So it's kind of cool that we're expanding. But for the most part, like my daughter said, I need a little bit more energy. So what we really want to start with is something that's concerning. You know, I'm not going to get political, but there's a lot of things going on politically here locally with Michigan State and a lot of the college students and everybody back to school. The hottest thing is, the uptick of cases. So, is it really an uptick of cases? Is it more severe? I've read studies with the young children that they're, I just read one this morning that, certain types of kids are passing away from this. It's a very small percentage. Again, it's all based on health. If you start reading below, it's not healthy ones are getting exposed and they are testing positive, but they're not being hospitalized. I talk to friends in the hospitals, and we're really not seeing an uptick of severe cases. The people that are sick to begin with, even at the younger kids, the ages from kindergarten up to 21, which they're looking at, also when they investigate them are having health issues to begin with. So the point is that we need to push, and I started this last week, is what is prevention? What is immune boosting? What are all these terms that we're using and seeing? And for the young, healthy kids, like I watched the interviews from Michigan State, we're young, we're healthy, we're in shape, we're not too concerned. He's right in some ways, but we can't be that cavalier. We have to be cautious. It's not just cautious wearing, I'm not just pushing wearing a mask, staying 6 feet away. That's not the only message. My message is, I've built my practice on prevention. So what can we do to prevent it? So it's the simple stuff. It's the sleep-wake cycles. Make sure you're rested, not that you're run down and tired. That's a simple one. Make sure your nutrition is up to date. Make sure you're working out. Make sure you have a good, balanced diet. It's the simple things that are going to get you. And don't necessarily stay in this sterile environment. Because another thing we talked about many times is that you need to build your immune system. The immune boosting, we can help with our IV therapies, but you want to be exposed. Like my kids make fun of me. My biggest comment is, we don't need enough dirt. I mean, it's very funny, it's sarcastic, but there's a lot of truth to it. So the message is, for all the college kids, for everybody else out there, don't just it's not just a mask, it's not just 6 feet away. It's doing the right thing. It's not partying all night. It's not drinking. It's not running your system down. What does all that do? It always lowers your immune system. It immunes your body to fight off what you need to do in cases like this. Before COVID, we were talking about flu seasons. You're talking about other infections. You're talking about colds. If you were someone that always got sick, then you may be a little bit more prone. If you're someone like, I feel, crappy for a couple days and I was fine, that's okay. People that travel a lot. You have to understand who you are and do a prevention. Is it a multivitamin day? Is it one of the airborne, gummies? What you need to do to build your own immune system. So the simple stuff that you have to definitely control. Don't get run down. Sleep-wake cycles need to be appropriate. Don't party all night. And basically you need to, work out. I'm real big on exercise and working out. I think that builds up your immune system the most. So, and again, eat some type of dirt. So that's my initial message that we're going to start with. We have a lot of questions. We're going to start with the first one. I had a stress fracture in my ankle in 2018. Lately, it's been bothering me again. How can I prevent another fracture? So stress fractures, I don't know if you're an active person or what's going on, how you got it, if you fell. Stress fractures a lot in the ankle are people that usually classically, I'm not going to guess what type of person this is, but some of my young female runners, they're most prone to things like this. Young runners, cross-country runners, things like that. The other issue is if you had a bad fall, you had a stress fracture, If you fell onto it and it's not a full fracture, some people call it a stress fracture. So how can you prevent other fractures? We worry about with ankles and stuff like that. If you're elderly, we didn't get the details on how old you are. Sometimes it's balance issues. Sometimes we'll work on balance. We'll work on strengthening. Like the biggest thing I tell people, and you can do it right now for all of you listening, or if you're standing, get up on your toes, come up and down on your toes. If you're real weak and it's hard to do, and your ankles are weak. Ideally, you want to see if the outside of your ankle is strong. Classically, the outside of your ankle is usually weak. The way to test is to lift your big toe. So if this is your foot and this is your big toe, you're lifting your big toe up and just pushing up and down with your other 4 toes. That will change the dynamics of your foot and usually show that you're very weak. If you're unable to do that, that means you have a lateral or outside your ankle weakness, which will lead to ankle issues, ankle fractures, poor balance, and stuff like that. So there are simple stuff you can do. It's balance a lot of times with ankles, ankle strengthening. Sometimes I say you need to do what I call toe-ups while you're brushing your teeth, which you're supposed to be brushing your teeth up to 2 minutes. So if you can do that ankle exercise like that, sometimes I tell you go to a first step or a stair, where you're up on the step, where your toes are here, your foot's down, and you're pushing up, and you're putting all your weight. So for those, it's your body weight that you're lifting, so technically that's a good workout. So, what to look for stress fractures, it's usually weird, achy discomfort versus severe pain. So you want to be careful of that. It's not that common, it shouldn't be that common. Usually in my thin, like I was saying before, in my thin young female runners, their bone structure gets compromised sometimes, and that leads to these stress fractures, which if it's happening as you're older or frequently, you definitely need to be checked for osteoporosis or osteopenia, which means your bone structure is not as strong as it could be. So that's a big red flag that we start looking for, that we work up for right after if you're having frequent stress fractures, especially in your feet. So moving on, question 2. I started working out again and my knee is hurting mainly after running. The swelling went away, but the pain returns every time, 3 days a week. Will I keep having this problem? So there's a couple ways to look at this. If you're having swelling every time you run, it usually tells me that something's wrong with the integrity of the knee itself. Most commonly, it's the meniscus. So if we pick on our knees, which is, actually, so this is one of our aged knees. So basically, this is the outside, this is the inside, this is your knee itself with the kneecap missing. So what basically happens, if you're getting swelling, there's the meniscus here, which is the cushion part. So if we look in here, this is the cushion part of the knee. This actually knee has a lot of arthritis to it. So the cushion part wears out or tears, which causes most frequently the swelling. The swelling is an indication that there's a pathological problem. It's usually not benign. You usually have to go do something about it. And it can wear itself out. How does it wear itself out? Basically, if the meniscus heals, which takes a long period of time, you want to see scarring of the meniscus. And once you see scarring, you're kind of filling in that disruption or defect in your knee, which will lead to hopefully less swelling. A lot of times, if it's happening all the time, you need to have that looked at. If you're swelling, technically after the first time, you should be coming in because it's an indication there's a problem with the integrity of the knee. If you're trying to run through it and it's getting better, you may be regaining the strength of your quadriceps from the running, and it'll reduce the actual friction on the knee. So for someone who hasn't, like we take the person who hasn't run for 6 months because of COVID, and you're not exercising as much, what will happen is I've always talked about core muscles. There's core muscles around the back that everybody's very familiar with, but it's over every joint. There's a core muscle structure. So what happens if you haven't been doing your exercise or working out, you're losing that core structure. So if you've lost that core structure and you try and go back to what you were doing before, you're actually putting a lot more stress on the joint itself because the musculature has weakened. When the musculature is weakened, it puts more stress on that joint, which can put more stress on the ligaments and the meniscus, which will cause that irritation and the swelling. So the simple solution may just be that. So you need to, like I told one of my patients today, you can't just come out of the gate doing 100% of what you did before. Technically, you got to do somewhere between 50 to 60. If that's okay, you hold it about 75 for about, a couple, technically at least 7 to 10 days, where you're building up that strength to go back to full blast. Some people that are younger can move a little bit more aggressively, but you need to understand your body. This isn't a push through. This isn't like, oh, the swelling's just going to go away on its own. No, that's a big indication that there's a problem. Swellings are number one red flag that there's some internal tear or issue going on. I'm hoping that it's just because you've lost the core strength of the infrastructure around your knee, which is causing that swelling. So, question 3. What are your thoughts on IV vitamin therapy? So there's 2 parts to this question, apparently? Mm-hmm. Okay. So Nicole says there's 2 parts. So IV vitamin therapy, what are my thoughts? Absolutely. So is it someone, if you're really doing a balanced diet, I'm not going to fight into the vegetarian diets, the vegans, and what's being missing from that, and that if you take certain nuts, you're supplementing proteins and things like that. If you feel you do a healthy, balanced diet and you're of good age, meaning between the 20s and 40s, 20 to 35, your body should be fine. If you have other medical issues, it can advance faster than that. But basically, IV therapy definitely shouldn't hurt. If you're not going to be using it, you get to pee it out, okay, for the most part, unless you're getting abusive. You don't want to be abusive. Anybody who's delivering IV therapy should have regulations and policy and procedures in place that they're not doing that. So I'm going to assume that you're getting appropriate IV therapy. In this case, we're talking about IV vitamins. It should boost your immune system. It should make you feel healthier. Do you absolutely need it if you're doing everything that we're talking about, the balanced diet, the balanced meal, that you're healthy? Typically, no. Your body should be able to reproduce and be able to be healthy and restorative itself. So the simple answer is IV vitamins is absolutely a benefit. A multivitamin almost at any age is a benefit. I mean, if you truly have that balanced diet and you're very anal about what's going in your body, you might not be one of those people. The majority of people I know are not those people that need a balanced diet and definitely could benefit from some type of vitamins. IV vitamins, again, it's going through your intravascular system. It's passing the gut, the GI system. So technically, you're getting better absorption. For most vitamins, they're more readily available and bioavailability. So when it's going through IV, meaning through your blood system, it's usually faster delivery system than swallowing it in your gut. The second part of the question is PRP, stem cell, and IV therapy. Would any of them be benefits for the effect of neuropathy? So the simple answer is yes. There's a lot of studies going on. If we talk about IV therapy, there's cocktails out there. If you really get into IV therapy, there are certain cocktails. There's certain cocktails to help restore, mental thinking, clarity, nerve involvement, things like that. Do I swear by it? No, I don't swear by it. Do I feel it's helpful and beneficial? I think there is a benefit. But when we start talking about PRP and stem cell, yes, there's studies that are starting to come out that are showing definite improvement with nerve regeneration. Now, if you're talking about like neuropathy for diabetes and things like that, it's not so clear cut that, okay, you take this and it's a guarantee. There's different levels of neuropathy. The sooner we get it, like diabetic patients are ones who need to live a much healthier lifestyle than the rest of us because they are prone to neuropathy. That means they get destruction of the nerve sheets and therefore they lose their sensation. So that means sometimes the fine sensation of your feet, of your fingers, those are things that go first. We call it what we call a stocking glove and socks. It's like goes around those areas. So it'd be a stocking glove, so up to here, and then on your feet would be like a sock. Those are the areas that leave sooner. And you also lose like your hair follicles, so you just get poor nutrition, poor blood flow. So it's a whole combination of things. So when we talk about stem cell and PRP to benefit, it's not such an easy answer. It depends what the true root of the problem is. It is becoming one of the treatment options, though, for it. So unfortunately, you probably need to come in. We need to evaluate exactly what what the purpose is. If you're far out and you've been a diabetic for 40 years and you have no sensation, and we do a nerve test and we can't find anything, it's less likely. But if we do it and the nerve test shows that you're just mildly off, these are things we can do to help slow down the progression of the disease. And that's a lot of things that we talk about. I may not be able to reverse aging or anything like that. We're just trying to slow the progression. You've all seen the people that are 40 years old and they look 80, and you've seen the 80-year-old that looks like she's 60. Those are people that you need to who you're going to frame yourself after. Would you rather frame yourself after the 80-year-old that looks like 60, or the guy who's 40 and looks like 80? Smoking, drinking, tough life, stress, that's also going to play a big mental role on you. So, moving on, question 4. Acute tendonitis in my knee. How long will it take for the pain to go away if I take proper care and follow up with my doctor, what my doctor said? So, ideally, acute tendonitis should improve with it. If it's being treated properly, it's like my rule of 2 weeks. 2 weeks, you should start feeling better. That doesn't mean you're all better at 2 weeks. That means you should start feeling like you've made progress, about 50% progress. For a true tendonitis that's involved, it's anywhere from 4 to 6 weeks for natural physiological healing. If it's over that, then there's a problem. But the thing is, with a knee, it's not like you're in a vacuum. You're not just resting the knee. You have to use it. So each day you probably irritate it, so it slows the progression. Like if you have a very active job, if you're on the assembly line, if you're getting up and down a lot for work, if you're a dental hygienist, those kind of things, you're causing irritation. So what we try to do is either brace it or support it, teach you how to ice it throughout the day, so you're not aggravating it throughout your day for 8 to 10 hours, 6 to 8 hours, whatever. Even sitting in front of a computer right now with your knees bent is causing an irritation. So it's how well you listen, like you say you're listening to your doctor here. What does that really mean? Are you just taking it easy? Are you using a cane? Are you using crutches? Are you limping? So there's a lot more to it. The simple answer is that you should start feeling a lot better within 2 weeks. If you have an injection, that speeds it up. PRP is great for tendonitis that's being a little bit stubborn or resistant. Medication, creams, ice, heat, what we call acupressure, depends on where it's at. In this case, the knee, it's a little bit harder, but there's something called an acupressure that you go and you manually break up the tendonitis and then you ice after. So there's a whole bunch of things you can be doing to be very proactive. So, hopefully the simple answer is you should feel better in 2 weeks, all better within 6 weeks. If not, you probably need to switch directions. And the other thing is, we send a lot to physical therapy, with electrical stim, with ultrasound, all that. What are you laughing at?
Okay, just relax your forehead.
I'm getting advice from my daughter. I was getting more intense. You wanted me to be more intense, more astute. I didn't want to put you to sleep again. Anyhow, so for the others listening, hopefully we're my forehead, I'll need Botox later. All right, so everybody's making fun. I love it. We love interaction. So that's the other thing before we get to our last question. And we really want to push it out. We're at 20 weeks here. We feel we've benefited. We want you to share. It's been getting more views lately. We have a lot of new doctors, a lot of new things going on. Talking to a lot of people lately about the changes. I think everybody's getting to their boiling point right now with COVID. We're staying in. We're getting used to a new change. I think everybody's worried with the winter coming. And with the gyms opening up, I think we don't get overly excited, get appropriately excited, get yourself in shape. Again, going back to what I said at the beginning, I would love for all the political stuff to start pushing. Let's do it. What can we do for prevention other than just wearing a mask and staying 6 feet away? If I could start a campaign for that, and I think I could get all the gyms and the trainers and the nutritionists and the dietitians behind me on that, I'd love to spearhead something like that. So if you think I'm right, send comments because it'll motivate me, because I think that's the real message. Let the politicians go fight with, the CDC and the positive testing and all that stuff. It's the effects. I almost want to push. How many times do we get positive for the flu and we're asymptomatic throughout? You've got to put it in perspective. Right now, my daughter's school's got shut down for 2 weeks. It's crazy. It's changing everything. Even like the Big Ten with the football. And Nicole's telling me not to get too far off track here. But, look at it. These guys, the ACC, the other guys started doing it. We're in a bubble for basketball. Overall, don't be too cavalier. Let's be smart, but let's focus on what we can do to prevent it and help each other and encourage each other. For the elderly, yeah, we're in a different place. I got elderly people that are exercising way more than my 20-year-olds. So, it's where your head is, where it's made up. And don't just feed into all this negativity. You can't be bogged down by the negativity of the politicians. You got to find a way to motivate and be positive. Like I said, it's not that hard. Stress plays a role. Stress will lower your immune system. Unfortunately, the stress levels are up tremendously. I told you I read articles about COVID in young people. I've read about suicides that are up tremendously too. So we need to push on being positive. So the fifth question, what sets your practice aside other than sports medicine doctors' offices? So if you haven't figured that out by now, I don't know how to answer it. So that's the confident way of saying it. But to be honest, it's what I said. I had a friend in here today he's very needy, very difficult, and it takes a lot for him to go see a physician. And he said, he goes, I come here because you're going to talk to me, you're going to tell me what it is, and you're going to educate me, and you're going to try to think I'm making the decisions, but you kind of direct it yourself. It's kind of true. We've seen a lot. I'm not saying I wasn't smart at the beginning, but I've learned a ton over the last 20 years. It's fun with having Dr. Bonat here because I can see on his face that he's observing what I'm doing. He's taking in like the positives. And so there's good and bad to learn from everybody. In this office, I've just had the liberties of working with some of the top athletes in the state, some of the top entertainers, some of the great young athletes. And to be honest, I work with 60-year-old women that are nurses' aides at nursing homes that love their patients and want to get back to work. So I have the whole gamut to motivate me to make sure I'm doing the right thing. And I don't mind being challenged. A lot of sports medicine doctors, if they don't want to be challenged, they got a level of insecurity, and that's not the right doctor. Or they got a level of arrogance you don't belong with. So here, I have a confident attitude, but I have no problems with getting you getting another opinion, challenging me. People Google stuff right in front of me. I think it's great. I ask you to challenge me. But again, overall, we're huge on prevention. I pushed the whole immune system. That's what I want to see. To beat this COVID thing, it's not just a mask and 6 feet. It's about being healthy, being responsible, and taking care of yourself. And for those who need help around you, take that extra help with them also. Encourage them to get up. Encourage them to walk with you. Encourage them to do the exercises and the stretches. That's what your give back is. And you want to help with COVID at that level and be a frontline worker, that's something you can do for the person next door that's maybe struggling. So that's where you need to be. Our practice, again, is not, we're not all equal. Not all PM&R docs, not all sports medicine docs are equal. We do a lot. I feel we're on cutting edge with our peptide treatment, with our PRP, with our stem cells. Dr. Bonat, highly educated here now and available. You're welcome to come in. You're welcome to challenge us at a personal level, at our physician level, whatever it takes. But overall, and then something. So this is Einstein. Mm-hmm. So Nicole's getting me not to do, trust your soul or peace out anymore. I have to sign off with a quote, and this is from Albert Einstein. Life is like riding a bicycle. To keep your balance, you must keep moving. So it is. That's our message. Keep moving, keep rotating. That's like it really falls into everything we talked about today. So if you have questions, don't hesitate to call. I love it. I love that. I'll be with my daughter this weekend. Madison, don't cause too much trouble. And love you all.